Medical Nanotechnology and Cardiovascular Medicine. Introduction. Welcome to today's lecture on the application of medical nanotechnology and cardiovascular medicine. In recent years, nanotechnology has revolutionized the field of medicine, offering unprecedented opportunities for targeted drug delivery, early disease detection, precise imaging techniques, and personalized treatment options. This lecture will delve into 12 prominent areas where nanotechnology has made significant contributions to cardiovascular medicine, including nanoparticle-based drug delivery systems, targeted nanotherapeutics for atherosclerosis, engineered nanosensors for early detection of cardiovascular diseases, nanoimaging techniques for assessing cardiac function, nanodevices for real-time drug release monitoring, nanoparticle-mediated gene therapy for cardiac regeneration, nanomaterials for developing bioengineered blood vessels, nanorobots for targeted thrombolysis and ischemic stroke, nanoparticle-based vaccines for preventing cardiovascular diseases, drug-loaded nanostructured stents for controlled drug release, nanoscale biosensors for monitoring heart rate and blood pressure, and the critical evaluation of biocompatibility and safety in cardiovascular nanomedicine. Nanoparticle-based drug delivery systems have emerged as a promising approach for improving the efficacy and safety of cardiovascular therapeutics. By utilizing nanoparticles as carriers, drugs can be targeted directly to the site of action, minimizing off-target effects and reducing systemic toxicity. These nanoparticles can be engineered to possess various properties, including controlled release, long circulation times, and active targeting capabilities. For example, liposomes and polymeric nanoparticles have been extensively explored for delivering antihypertensive agents, anticoagulants, and antiplatelet drugs. These nanocarriers can improve drug stability, enhance bioavailability, and provide sustained release, thereby optimizing therapeutic outcomes while minimizing adverse effects. Atherosclerosis, a major contributor to cardiovascular diseases, is characterized by the deposition of plaques in the arterial walls. Nanotherapeutics offer a targeted approach to combat atherosclerosis by delivering therapeutic agents specifically to the plaque sites. Several strategies have been employed, including passive targeting through the enhanced permeability and retention effect and active targeting using ligands that bind to receptors overexpressed in atherosclerotic plaques. For instance, nanoparticles decorated with peptides targeting scavenger receptors have shown promising results in selectively delivering anti-inflammatory drugs to plaques, reducing both plaque burden and inflammation. Early detection of cardiovascular diseases is crucial for effective intervention and improved patient outcomes. Engineered nanosensors have paved the way for highly sensitive and specific detection of disease biomarkers, facilitating early diagnosis. Nanosensors can detect biomolecules, such as proteins, nucleic acids, and metabolites, at ultra-low concentrations, enabling early disease detection even before symptoms manifest. Functionalized nanoparticles, quantum dots, and nanowires have been employed as sensing platforms, offering rapid and reliable detection of disease-specific biomarkers, thus enabling timely intervention and personalized medicine. Accurate assessment of cardiac function is essential for diagnosing cardiovascular diseases and monitoring treatment response. Nanoimaging techniques, such as magnetic resonance imaging, MRI, computed tomography, CT, and positron emission tomography, PET, augmented with nanoscale contrast agents, have revolutionized cardiac imaging. Specialized nanoparticles, including superparamagnetic iron oxide nanoparticles, quantum dots, and gold nanoparticles, can be targeted to specific cardiac structures, allowing enhanced visualization of molecular and cellular processes with high resolution and sensitivity. Moreover, multifunctional nanoprobes can provide combined anatomical and functional information, enabling comprehensive evaluation of the cardiovascular system. Monitoring drug release in real time is crucial for optimizing therapeutic outcomes and minimizing adverse effects. Nanodevices, such as nanosensors and implantable devices, offer the capability to measure drug release kinetics at the site of action continuously. For instance, stimuli-responsive nanoparticles can be engineered to release drugs upon exposure to specific triggers, such as pH, temperature, or enzyme activity. These devices provide valuable information about drug pharmacokinetics, allowing healthcare professionals to optimize drug dosing regimens and personalized treatment strategies to improve patient outcomes. Cardiac regeneration holds great promise for restoring the damaged heart tissue after myocardial infarction. Nanoparticle-mediated gene therapy has emerged as a powerful tool for inducing cardiac regeneration by delivering therapeutic genes specifically to the damaged sites. Nanoparticles can protect the therapeutic genes from degradation, enhance their cellular uptake, and facilitate controlled release. By delivering genes encoding growth factors, stem cell factors, or microRNAs, nanoparticles can promote cardiac cell proliferation, angiogenesis, and tissue remodeling, leading to improved heart function and tissue repair. The development of bioengineered blood vessels holds significant potential for treating cardiovascular diseases, such as arterial stenosis and coronary artery bypass grafting. Nanomaterials, including biodegradable polymers and hydrogels, have been extensively explored for constructing blood vessel scaffolds that mimic the native extracellular matrix structure. These scaffolds provide mechanical stability, support cellular adhesion, and guide tissue regeneration. Additionally, functionalized nanoparticles can be incorporated into these scaffolds to enable controlled release of growth factors or facilitate targeted drug delivery, enhancing the repair and regeneration of damaged blood vessels. Thrombotic stroke is a life-threatening condition characterized by the formation of blood clots within cerebral arteries, obstructing blood flow to the brain. Nanorobots, also known as nanomotors or nanomachines, hold promise for precisely targeting and dissolving blood clots, restoring blood flow, and minimizing neuronal damage. These nanorobots can be remotely controlled and guided using external magnetic fields or ultrasound, allowing them to navigate through the bloodstream, reach the site of thrombus, and deliver thrombolytic agents precisely. This targeted approach improves treatment efficacy, reduces hemorrhagic risks, and enhances patient outcomes. Vaccination plays a vital role in preventing cardiovascular diseases, particularly those caused by infectious agents like bacteria and viruses. Nanoparticle-based vaccines offer several advantages over conventional vaccine approaches, including enhanced immunogenicity, improved stability, and targeted delivery. Nanoparticles, such as virus-like particles, liposomes, and polymeric nanoparticles, can be designed to present antigens in a highly organized and immunogenic manner, promoting a robust immune response. Furthermore, the incorporation of adjuvants, immune-stimulating molecules, in the nanoparticle formulation can further enhance vaccine efficacy. Coronary stents are commonly used to restore blood flow in stenotic coronary arteries. However, restenosis, the re-narrowing of the treated artery, remains a significant challenge. Nanostructured stents loaded with therapeutic agents offer a promising solution by continuously releasing drugs locally to prevent restenosis. The surface of these stents can be engineered with nanoscale coatings or drug-eluting nanofibers to achieve controlled drug release kinetics. The released drugs can inhibit cell proliferation, suppress inflammation, and promote endothelialization, improving long-term stent patency and reducing the risk of restenosis. Accurate monitoring of heart rate and blood pressure is essential for diagnosing and managing cardiovascular diseases. Nanoscale biosensors provide next-generation wearable monitoring devices that offer real-time data on these vital signs. Nanosensors can be integrated into flexible and skin-friendly materials, allowing comfortable and unobtrusive monitoring. These biosensors can detect physiological fluctuations, transmit data wirelessly to electronic devices, and provide continuous monitoring of heart rate and blood pressure, enabling early detection of abnormalities and personalized management of cardiovascular health. Ensuring the biocompatibility and safety of cardiovascular nanomedicine is of paramount importance for clinical translation. Comprehensive evaluations are required to assess potential risks, including nanoparticle toxicity, immune responses, and long-term biocompatibility. Preclinical studies involving animal models and in vitro experiments can provide insights into the safety profile of cardiovascular nanomedicine. Furthermore, well-designed clinical trials are essential to evaluate the efficacy and safety of nanomedicine in human patients. Regular monitoring and rigorous quality control protocols should be established to ensure the continued safety and efficacy of these nanomedicine products. In conclusion, medical nanotechnology has opened up exciting avenues for transforming cardiovascular medicine. The integration of nanotechnology into various aspects of cardiovascular care, such as drug delivery, therapeutics, diagnostics, and monitoring, has the potential to revolutionize patient outcomes. The 12 discussed areas, ranging from nanoparticle-based drug delivery systems to biocompatibility evaluations, exemplify the breadth and depth of nanotechnology's impact on cardiovascular medicine. Continued research and development in this field hold great promise for future advancements in preventing, diagnosing, and treating cardiovascular diseases, ultimately leading to improved patient outcomes and enhanced quality of life. Thank you for your attention.